One thing we need to realize when it comes to proper function of the core is that mobility and flexibility matter more than we think. Too often do we try to strengthen the muscles around the core without looking at other areas to make sure we have optimal flexibility, mobility, and range of motion. Why that matters really comes back to a concept. Two professionals, Gray Cook, who's a physical therapist, and Mike Boydell, who's a strength conditioning coach, they realized that there was this alternating function throughout the body. So if we start at the bottom, the ankle should be mobile, the knee should be stable, the hip should be mobile, the lumbar spine should be stable, thoracic spine should be mobile, cervical spine should be stable. So this is an alternating relationship throughout the body. And if we think of the core, if we think of this lumbar spine and pelvic or hip region, we need to have a nice stable lumbar spine, but there's an issue if we lose mobility at the thoracic spine, middle part of the back, and the hips. What that does is creates an environment where the body has to move somewhere else. So if we are so tight and restricted through there, which is common if you think, because if you're sitting at a desk, if you're always on technology, a computer, or you're in an airplane, I mean, we all know those airplane seats are so crammed and tight in a more of a rounded position. If we're losing range of motion and flexibility, mobility at those joints, it's going to create an environment where the lumbar spine has to move a little bit more to accomplish everyday tasks, because we need to have mobility at certain areas, stability at other areas, but when we start to lose those traits, those other joints tend to switch functions to some degree. And if we have a lumbar spine, a lower back that has to move too much throughout the range of motion, this develops more wear and tear, degenerative disc disease, herniated lumbar disc, different facet joint problems, spines and stress fractures. These are the types of injuries, overuse injuries, will create at the core if we lose mobility elsewhere. So what I want to do is just walk you through a couple of very simple flexibility and mobility drills for the hip and the thoracic spine, because unless we are paying attention to those, we can strengthen this all day long, but if we're creating too much movement and too much stress through that lumbar spine, strength is only going to matter so much, because that body, our body's going to have to move somewhere, and more often than not, it's through that lumbar or lower back region. So let me walk you through a couple simple flexibility and mobility drills. So I'm going to walk you through a series of mobility drills for the thoracic spine first, 2 of them, and then 3 mobility drills for the hip. Again, making sure you have mobility here is so important when it comes to function of the core. So I definitely recommend take these seriously, do these things in addition to your core strength and stability program, and you'll see better results moving forward. So first one, side lying thoracic spine rotation. So important, because as we start to come forward into this rounded upper back position, we lose the ability to extend and rotate. So this is a very important drill, something I work on a daily basis, every morning, to be honest with you. So what I want to do first here is to get the legs stacked. In this position, you'll notice the hip wants to sit back. So try to get the knees flush in this straight line. Arm is up, bottom hand is holding that top leg down. I'm going to breathe and try to rotate as far as I can. So here, working on rotation at the spine. You'll notice as you breathe and exhale, you'll be able to gain a little more motion, again, releasing some tension from the tissue, and using breathing and expansion and compression of the rib cage to allow you to rotate a little further through the range of motion. Another good thing about this one, if you work on it on both sides, is one side more restricted than the other. If you have a restricted side, work on that side more, and I would definitely apply that rule to everything else you see through these mobility drills. Okay, so doing that on both sides is important. Hold for 30 to 60 seconds. Seriously, if you're sitting at a desk, you should be working on this probably 3-4 times a day, because we don't want to suffer and sit in this flexed position. Even though we think we're upright, we're really starting to lose that normal curvature at the spine. So making sure we have thoracic mobility is important. So do that on both sides. From there, I'm just going to show you at an angle. I'm going to drive my hips forward, pull my rib cage down, hands behind the head. This is a trunk tilt. So instead of working on rotation, I'm working on lateral flexion, okay, which is good to really even free up some motion at some of these muscles around that thoracic spine. But you can just find a couple different motions there. Laterally tilt and that helps mobilize the spine and lateral flexion. As you can see, I incorporate a little bit of rotation to find different angles to loosen up the spine, but that is a very good drill there. So as we move down to the hips, 3 I want to work on. First one, the adductors, okay? Big area, these muscles, series of muscles in the inner thigh, some longer, some shorter in here, but attach up to the pelvis that, depending on their length and tension, can cause different shifts within the pelvis or different rotations within there. So first one is the straight leg adductor rocking. So I'm going to go quadruped position, straighten the foot out to the side, walk my hands over so my hands are right down the midline of my body, foot is right on the inside of the shoe, and then from here I'm going to sit my butt back. As I sit back, I feel a big stretch through the inner thigh on both sides. So I'm going to rock back, hold, 1, 2, and then relax. So we're working on mobility here at the hips and lengthening through the adductors, so that rocking motion is pretty important. Okay, so I would do that on both sides. And then from there, bent knee adductor rocking, almost like I'm just in a frog position here. My feet are somewhat together. My knees are wide as you can, as far as I can go. And then from here, I'm going to sit back into my heels, and I'm going to relax back. So more of the short adductors here because my knees are bent, as opposed to the straight leg version I did a second ago. Sitting back into the hips, feel a big stretch, and then relax off, okay? After that, we can go into the pigeon stretch. Pigeon is going to stretch these hip external rotators that come off the sacrum and attach over to the femur, kind of the greater trochanter over here. So pigeon stretch, getting the shin straight across. If you have trouble doing that, use the knee of the back leg, almost act as a fulcrum, and to really pivot that foot up. And then from there, what we're going to do is sit back into the hip. Again, we want to rock, about 5 to 10 rocks per side. Seeing if one side is harder to get into that position than the other. Okay, so that's our second one, the pigeon stretch, the rocking pigeon stretch. From there, half kneeling hip flexor stretch. Very good stretch for anyone, to be honest with you, if you're sitting at a desk especially. But you need to realize that these hip flexor muscles actually will start to tilt the pelvis forward. A lot of times that tilt forward shortens those muscles at the lower back to create more tightness in there. And also that psoas muscle, which comes from the front of the hip here, courses through the body and attaches to the lumbar, the lower thoracic and lumbar vertebrae. So a lot of times, if that is tight, it actually starts to tug, think this forward, so it creates more of an arched position at the back. So that psoas muscle could be a culprit when it comes to low back pain or a lot of pressure at those lumbar discs. So just to see that, very simple, lunge position. Back is up tall. I want to tuck my hips under. So I want to be in an anterior tilt. I want to be in a slight posterior, neutral to posterior tilt. And then from there, digging my back toe into the ground, not going this position. I'm not a big fan of that one. Back toe into the ground, hips under, small lunge forward. So I'm contracting that toe down, which is pulling the hip back in the socket. And then I can just do a small lunge forward, a stretch right through that hip flexor. If I need more of a stretch, I can lift my arm up overhead. I can rotate and even tilt away from that low leg. Okay, so those are a couple of drills to work on flexibility and mobility at the hips and the thoracic spine. So those are various mobility drills to help work on how the thoracic spine and hips are moving. Again, any or increased tension or tightness, restricted range of motion at those thoracic spine and hips is going to create more stress, more wear and tear through the lumbar spine. So that is why it's always important to look at joints above and below. If we're trying to strengthen the core, it only makes sense to look at mobility above and below to make sure we're moving properly so we're not overstressing. Okay, so that's important to really realize that what's called the joint by joint approach, Gray Cook and Mike Boyle. I definitely recommend looking into that on your own. It's an important approach that you can apply to other areas throughout the body, but mobility is important to make sure we're moving in the right joints as we complete everyday movements to make sure we're not creating more wear and tear at those series of joints that should be stable.